Welcome to an overview of the PICO framework from the Health Sciences Library at the University of North Carolina at Chapel Hill. This is part of our Resident's Guide to Library Resources. This video will cover how to use the PICO framework to improve your literature search skills. We will demonstrate its use in PubMed, but you can use it in any biomedical literature database. We will walk through how to use the PICO framework to turn a research question into search terms, including how to refine your search terms for the best search results. The PICO framework helps you determine your research hypothesis and can also help you determine which search terms you should use to find literature that answers your clinical question. PICO is meant to be used for intervention studies, but there are other question frameworks that can help with different kinds of questions. Let's break down the framework letter by letter. The P stands for the patient or population, meaning who is affected. The I stands for the intervention or exposure of interest, meaning what is being done, such as the primary therapeutic choice. The C stands for the comparison intervention, meaning what else might be done, such as the gold standard for treatment. And the O stands for your outcome, meaning how you will measure the effect of the intervention, such as preventing or changing a particular condition. You can also add on to the standard PICO framework. You can add a T for the time frame of interest, such as 6 months, a T for the types of studies that will best answer your question, such as a research clinical trial, or an S for the setting of interest, such as an outpatient clinic. If your initial search is too broad, these additions will help you more quickly find the most useful articles. Let's see how PICO works with an example question. In this scenario, I want to know if patients with chronic hypertension are at an increased risk of readmission after an operative intervention. My population is patients with chronic hypertension. My intervention is any surgical intervention. My comparison would be patients who do not have chronic hypertension. And my outcome is readmission. Since I'm most interested in readmissions within 30 days, I could also potentially add a time frame to this search. So we have our PICO framework. Now I want to turn that framework into search terms that I can use to find articles. I could search it as it is, but when we are searching in a database, it's best to only use the words that are essential to the search. We also want to think about what synonyms could be added to find articles that are using an alternative form or spelling. Here's my starting search, using a pared down form of the terms that I had added to my PICO framework from my initial research question. I simplified my patient and population from chronic hypertensive patients to hypertensive. I simplified my intervention from any surgery to surgery. I removed my comparison and kept my outcome the same. I also simplified my time frame from within 30 days after operation to just 30 days. Now let's put our search terms into PubMed and see what search results we get. We recommend you use the HSL website to access PubMed. If you use the PubMed link from the HSL website, you'll have access to all the full-text articles from the journals that UNC subscribes to. In PubMed, I'm going to put my search terms into the search box, adding "and" between each search term to tell the database I want articles containing all the terms. So, hypertensive, and surgery, and readmission, and 30 days. And then click search. There are potentially some good results here. I have 330 results, but I thought there would be more articles on this. I'm going to try some additional search terms to make sure I'm not missing anything relevant. Let's go back to our PICO and see how we can expand the search. As a refresher, here was our PICO framework and our original search terms. So for my patient population, I could add hypertension or high blood pressure to hypertensive. I could also add other synonyms for surgery, like operation or surgical. I could also add the term postoperative, since I'm interested primarily in a postoperative outcome. And then I could also add readmit, or even an informal term like bounce back, to capture more studies for readmission. And finally, I could spell 30 instead of using the number 30, or I could try leaving it off and seeing if I get other results that maybe don't mention a time frame for readmission. Here are our revised search terms. I've used or between my equivalent terms to tell the database that either of these terms can be included. Then I put them in parentheses to tell the database to use either of these terms and combine them with the next set of PICO terms. To combine each set of parentheses, I'm using AND, like I did in the original search. At the bottom of this table, I put all the terms together in the format I will copy into PubMed for my next search. I can also delete the last part if I'm still seeing too few articles and I want to expand my search more. Let's go back into PubMed and look at our new search results. Now that I'm in PubMed, I'm going to paste in these search terms that I just edited and click search again to see my new set of search results. I now get about 40 more results, and I can feel more confident that I'm not missing important literature because I didn't use the right search term. I could also continue to add synonyms to the search and see if additional articles come up. I also know, since I've used the PICO framework, that I've included all the important elements of my clinical or research question in my PubMed search. This has been an overview of using the PICO framework for performing literature searches. Check out our guide to the PICO framework at guides.lib.unc.edu/PICO. The resources mentioned today and in the other videos in this series will be available to you in a PDF format. The instructions for how to download this will be at the end of this video. We covered a lot today, so please contact your clinical librarian with your questions. They are happy to help. To access a list of the resources mentioned today, scan the QR code on the screen or go to go.unc.edu/resident-resources.